Hello and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Taraba Primary Healthcare Development Agency promises to continue to work towards reduction of vaccine hesitancy among residents. Federal Ministry of Aviation, in collaboration with Joint Consultative and Negotiating Council, sensitizes personnel on emerging digital technologies resulting from the pandemic. And England returns to Plan A as UK Health Agency prepares to switch focus to supporting vulnerable individuals. Thank you for joining us. COVID-19 prevention is our collective responsibility, and the National Primary Healthcare Development Agency is encouraging Nigerians to ensure safety in public places by taking the COVID-19 vaccine, wearing the face mask, ensuring physical distancing. The agency has also given a waiver for persons aged 16 and 17 to receive the COVID-19 vaccine if required for educational purposes. Meanwhile, infections appear to be declining as the Nigeria Center for Disease Control logged 75 new infections and 1 death in the last 24 hours. Here's more on the pandemic update.
75 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 8 states and the FCT that would drop from the figures reported earlier. Lagos accounted for the highest number of cases with 33 infections. Gombe had 13, while the FCT registered 11 cases. Osun, Edo, Rivers, Plateau, Kaduna, and Kano states logged a single-digit infection. The total confirmed cases in Nigeria now stand to 252,753. The report also includes 0 cases from Abia, Ekiti, Nasarawa, Ogun, Ondo, Oyo, and Sokoto states. 646 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 228,137. There was 1 additional death recorded in the last 24 hours, raising the fatality toll to 3,134. Currently, there are over 21,000 active cases in Nigeria, while more than 4 million samples have been tested so far. Over 14 million eligible Nigerians targeted for COVID-19 vaccinations have received their first dose, while more than 5.2 million of the population have been fully vaccinated. The total global confirmed cases have surpassed 362 million, while deaths are beyond 5.6 million.
In the southeast, the Ebonyi State government is now working with private health bodies to curtail the spread of the disease, especially the new variants. The Executive Secretary of the Ebonyi State Primary Healthcare Development Agency in Abakaliki, the state capital, disclosed that the Primary Healthcare Development Agency has devised new methods to take the vaccination campaign as well as the message of the necessary non-pharmaceutical interventions to the grassroots.
As far as Ebonyi State is concerned, I know we have been doing very well. Now I think we are one of the states that is doing very well concerning vaccination, COVID-19 vaccination. We have done so many things, and now the public sectors, that is the public hospitals and the private hospitals, are now involved. We have visited them, they have been trained so that their workers will be vaccinating in that particular hospital, that is private hospitals and public hospitals, not only in the health facilities or in the local governments. And now the recent one is that some pharmacy stores or their workers have been trained. Like we have one at Funai, we have one at Robam Pharmacy, we have another one, I think they are 3. Their workers have been trained so that they will be vaccinating people there in the pharmacy store. So the national has made it as a point of duty that even the local chieftaincy, what do you call it, the palaces, we have trained some of the Ndiezes those that people go there to their cabinet to vaccinate people in this Ebonyi state.
And the Federal Ministry of Aviation, in collaboration with the Joint Consultative and Negotiating Council, an umbrella body for the 4 existing trade unions in the ministry, is holding a sensitization conference for its personnel in the North Central to equip them with relevant knowledge on emerging digital technologies. This is to enable the personnel keep up with the changes in their workplace as a result of the coronavirus pandemic. According to the chairman of the Joint Consultative and Negotiating Council, the 3-day conference is also focusing on how workers can drive the automation process and personnel management system in the aviation sector.
There is a new norm, and that is digitalization. And I think is part of the roadmap of the current administration in the communication sector. And of course, aviation cannot be out of it. Now, automation, personnel automation is something that we must get into. We cannot continue in the old order. There will come a time where workers who perhaps are not disposed to this new norm will be certainly they will become redundant, and we wouldn't want that. So our job as unions is not only to fight. We can also preempt actions and see how we can avoid some certain things, especially job losses, when they become so imminent. COVID-19, world over, has provided an opportunity for people to understand that we cannot continue the normal way. You asked workers to work from home. How will they work from home if the system is not automated? So that's the sensitization. Who knows what will come out tomorrow? So, but this is an eye-opener, and we must take up this challenge so that we will not be taken aback. So that's what we're doing.
Meanwhile, coexisting with the coronavirus disease are other diseases and their impacts. The Nigeria Center for Disease Control recently activated the National Multisectoral and Multidisciplinary Lassa Fever Emergency Operations, EOC, that's the centers, in response to Lassa fever outbreak in some parts of the country. It reports that as of the 23rd of January this year, a total of over 100 confirmed cases with 26 deaths have been reported. Well, joining us to talk more about this is Ms. Chioma Danwafo, Incident Manager, National Lassa Fever Emergency Operations Center with the NCDC. Thank you for joining us on the program.
Thank you for having me. Good evening, Alison.
All right, good evening. The NMA recently expressed concerns over re-emerging infections, and this is in the midst of the coronavirus pandemic. What do you think is happening, especially in the case of Lassa fever?
Yeah, so for Lassa fever, we know that Lassa fever was discovered over 50 years, so it's not like it's among the new emerging diseases. It's been with us. But then we cannot also overemphasize the land use activities in the increasing number of cases that we are seeing of recent. In 2018, we recorded an unprecedented number of cases, and we began to ask ourselves what has changed. So we had to do genomic sequencing to be sure that the virus has not changed, or we're not having more vectors that are responsible for this disease. But we found out that nothing has changed. It's just that the surveillance system has improved, and these other factors like the land use, climate change has led to the increasing number of cases that we are reporting.
So do you think that there's a community understanding of these diseases and their spread, especially with Lassa fever springing up at this time?
For Lassa fever, the awareness is there, but we can't compare it to that of COVID. I mean, COVID, the average Nigerian knows about COVID, the symptoms. But for the hotspot states, which are the states where majority of our cases are reported from, as the Edo, the Ondo, Bauchi, and Ebonyi states, the awareness is quite high there. But for other states that report sporadic cases across the years, the awareness may not be as high as that of the hotspot states. So that's why we keep advocating and for media personnel and for political leaders, religious leaders, traditional leaders to help us pass this information. So what we have done is to intensify risk communication activities across board. Like he likely mentioned, we have activated a level 2 EOC. So this is to ensure that we harness all available resources to be able to respond effectively to this disease. Because early detection is key for survival for Lassa fever. We're able to detect early and initiate treatment early. The prognosis of the disease is better. That's higher chances of surviving. And the other aspect of it is the index of suspicion among healthcare workers. So we advocate that once a case presents, a patient, presents with those febrile illness-like symptoms, which is similar to COVID, similar to malaria, rule out COVID, rule out malaria, and start thinking Lassa. It could be Lassa fever. We have established more molecular labs for the testing of Lassa fever so that we can quickly detect cases and commence treatment across the different treatment centers we have in the country.
All right. Finally, earlier there was a report that cases of Lassa fever in the African population sort of decreased. The report said it was due to hesitancy in visiting clinics, and that's because of COVID, leading to unreported cases. Is that the case? Do you think there's perhaps a silent outbreak in West Africa? And this is than the numbers that even the NCDC has recorded.
Yeah, so I speak for Nigeria. For 2021, we recorded a lower number of cases compared to previous years. We had expected more cases, but then the numbers were not as much as we had expected. And there were speculations that it could be attributed to the overwhelming activities of the ongoing COVID-19 pandemic. So, but for 2022, the numbers are on the rise, and we're also trying to establish more molecular labs so that we can better detect this disease in the different states. If you recall, when COVID came, we had to leverage on the existing Lassa fever laboratories to start the testing of COVID. Now, what we are doing is also to leverage on those COVID-19 molecular labs across the country. We have over 140 laboratories now, to leverage on them to be able to establish and activate and optimize more laboratories for testing, because testing is key, detection is key. It's only when you detect that you can be able to commence treatment and reduce the case fatality rate. And I also like to mention that our goal is to have a less than 1-digit case fatality rate for Lassa fever.
And I take it that the preventive measures are quite similar as well. Good sanitation, personal respiratory hygiene, yes?
Yes, they're similar, but for Lassa, the main mode of transmission is from rodents to humans. So good sanitation is quite key. So we advise Nigerians to please ensure that you get rid of rodents in your environment, keep your environment clean, block any hole that will allow the rodents access to your house, and also practice hand hygiene. And secondly is for healthcare workers to have that index of suspicion. Once any patient presents, please start thinking Lassa. They present with symptoms of Lassa.
We appreciate your time. Thank you so much, Ms. Chioma Danwafo, Incident Manager, National Lassa Fever Emergency with the NCDC. Thank you for joining us on the program.
Thank you for having me.
Still to come, Africa's Center for Disease Control says 40 countries on the continent have now reported cases of the Omicron variant. We have that story and more when we return. Welcome back. The Africa CDC Director, Dr. John Nkengasong, says 40 countries on the continent have now reported cases of the Omicron variant. While speaking at the weekly CDC Africa briefing, he says 46 countries are going through the fourth wave, while 8 countries are going through the fifth wave. He adds that the trends show that cases across the countries have gone up the peak and are now starting to decrease.
Look at the trends since last week we met. We've recorded a total number of 228,000 new cases. And that represents about 12% decrease, 12% decrease. So it seems we've gone up the peak and we are beginning to decrease. And in terms of deaths, we recorded from last week to today, 2,300 new deaths. And that represents also a 19% average decrease in the number of deaths. If we now look at the 4 weeks period, as we usually do, and compare the period between up to yesterday, we recorded a total of about 5% average decrease, 5% average decrease over the last 4 weeks. In terms of new deaths, we've also recorded 18% average increase, which is expected as you see the number of new cases. Even when they begin to peak, those who were infected previously, you continue to see deaths occurring there. We hope that over the next couple of weeks, you'll begin to see a decrease in the number of these deaths. With regards to vaccines, a total of 580 million COVID doses have been received on the continent. And of that number, 64% total have been administered, with about 11% of the population fully vaccinated, 11%. Egypt is reporting a 24% fully vaccinated eligible population, Morocco 62%, South Africa 27%, Mozambique 29%, and Nigeria 2.5%.
Well away from Africa, Londoners had mixed views on the easing of coronavirus restrictions Wednesday after British Prime Minister Boris Johnson dropped COVID-19 measures, introduced the curb to the rapid spread of the Omicron variant in England. Prime Minister Johnson said that none of the so-called Plan B measures would remain in England, as face masks would not be legally enforced anywhere. Let's look at some of the reactions.
I'm mixed views on it because I believe that obviously the pandemic isn't necessarily just over, just suddenly like that. Say, for instance, on the tube, definitely think that we should still wear masks and things like that. But I do think we do need to resume some kind of normality, like people do need to be going back to the offices and getting back to work.
I think I would keep it in transport and crowded places like shops where people have to go. Not sure about social gatherings, though, and clubs and things like that.
So lift them all. Let's get rid of this COVID crack. It's about time we get on with our lives, I think, because the variants are getting weaker and weaker. We're all becoming more immune to it. So I don't see a reason why we should just get back to normality and stuff. So.
Well, joining us for more on the situation there, our London correspondent, Juliana Lainka, joins us now. Hi, Juliana. Mixed feedback since the government eased COVID-related restrictions. Give us a picture. The streets of England, are people confident to go out? Or, is it back to pre-2020?
Pre-2020, that would be great, Millicent. We're not there yet, but certainly Britain wants to put itself front and centre as being the first nation in the world to essentially learn to live with COVID. And that's not just a terminology that's been put out there. That's government policy that's currently being worked on by Prime Minister Johnson alongside Health Secretary Sajid Javid. As you said, I think there are mixed feelings and views, talking about, for example, not wearing masks on the London Underground. A lot of people feel really uncomfortable about it, which is why the Mayor of London, Sadiq Khan, has made it still mandatory for commuters who are using the Underground to wear masks, and also in public spaces. Just to bring the viewers up to date, so from today, all Plan B measures in England have been scrapped. So this is not just about mandatory mask wearing. This is also about showing, I think, probably the most controversial part, an NHS vaccine passport if you are going to large venues. You no longer have to do that. But there are still millions of clinically vulnerable individuals that don't feel like this is freedom. They actually feel like it's less freedom, because even though there are so many people that want to start living their lives as normal, there are other people who are still very, very afraid of COVID infections.
How does this apply? Do you think there's still nervousness? And this is among big chains, shop owners, who some who still want people, employees, customers to wear the face coverings?
Well, absolutely. We know that Sainsbury's and Waitrose are some of the big grocers that have said they will be asking people to still wear masks. But look, you know, Britain is still trying to recover from an economic slowdown. Just when the hospitality sector thought that they would be having a booming Christmas, along came Omicron and people started working from home. 5 million people were working from home in the run-up to Christmas, the peak season where lots of people would have been going out to restaurants and shopping in stores. We've already seen the data from the British Retail Consortium, as well as data that's compiled by Barclays and NatWest looking at consumer spending, that people actually, stayed away. They weren't going out. And I think now for hospitality venue bosses, it's a really difficult call, because no, they don't want people to be infected in their establishment, but they also want people to come in. And if you don't have that government legislation that backs you to give you power to say to people, don't come in the store unless you're wearing the mask, why would you? So I think it's really difficult. But I've got to say, generally, it does feel as if people are COVID fatigued. Yes, COVID numbers are still really high. We've got the latest data from the Office for National Statistics. Unfortunately, again, over 300 people lost their lives. There were over 90,000 positive infections yesterday. 16,000 people still remain hospitalized. COVID hasn't gone anywhere in this country, but people do want to start living again. People do want to start socializing again. And some people don't want these draconian rules to govern how they decide to live socially.
Just before we let you go, Juliana, I mean, under the current rules, is there still the vaccine mandate for the NHS staff?
Absolutely, there is. From the 1st of April, in England alone, we know that all NHS staff must be fully vaccinated. Not yet sure whether fully vaccinated will include that third booster jab. The NHS is the biggest employer here in the UK. And according to the latest data, I believe there are about 77,000 individuals that work in the NHS that haven't been vaccinated. Union bosses are completely against this, what they consider draconian piece of legislation. Sajid Javid, the health secretary, says it's absolutely a must, but it is still under review. And I think it's important to note that, unfortunately, for those from the Black minority ethnic community, especially the Nigerian community, we are the individuals that fall under that category, people that don't need to be losing their jobs at a time when we're under a really big squeeze in the UK. But according to the latest government law, if you are not fully vaccinated and you are working in the NHS at that time, you will lose your job.
All right, many thanks. Juliana Olayinka there, our London correspondent, joining us. Thanks again.
Thanks, Melissa.
Well, staying in the United Kingdom, new data that shows that the majority of patients in hospital in England with COVID are there because of something else rather than the virus. The latest figures for January 25 shows that a total of just over 13,000 COVID patients in hospital, 52% of them primarily were there for another condition and just happened to be infected. Here's more of the global update.
Today, England returned to its so-called Plan A, learning to live with COVID-19, a disease that's probably here to stay. Mask mandate and COVID passes lapsed, and work-from-home guidance ended last week. Now, the UK Health Agency is preparing to switch the focus to supporting vulnerable individuals rather than imposing national rules.
I have received firsthand, I have read a lot of...
Hong Kong's chief executive Carrie Lam says quarantine for arriving travelers have been cut to 14 days from 21, starting February 5th. A move that follows intense lobbying from finance executives and diplomats who say the measure is hurting competitiveness. Tough coronavirus rules have made Hong Kong one of the world's most isolated cities, with flights down as much as 90%. Residents returning from more than 160 countries have been required to quarantine for 21 days in designated hotels will now have to spend 14 days in a hotel, followed by 7 days of self-monitoring, with further details to be announced. Germany has hit record-high cases on the second year of the coronavirus pandemic. Chief physician for infectious diseases Wolfgang Gergimer says being a new territory for him, there was a lot of building blocks that showed that the virus was something not seen before, a new illness with a manifestation not known. He said there were a lot of difficulties at the beginning with not enough masks or protective clothing and the slow vaccine rollout, then the second, third, and now fourth wave of the coronavirus pandemic. Finally, the cumulative COVID-19 cases in the United States exceeded 72.9 million as of Wednesday, with the death toll surpassing 875,000, according to the Center for Systems Science and Engineering at Johns Hopkins University. The U.S. Centers for Disease Control and Prevention predicted on Wednesday that more than 62,000 people could die from COVID-19 over the course of the next 4 weeks. The CDC projections show a slow but steady increase in new deaths in the United States in the first 3 weeks of the year, followed by a decline in the fourth week.
Our website has more updates, a better understanding of the pandemic. It's channelstv.com, news at your fingertips. Well, that's the program this evening. Thank you for watching. I'm Millicent Walker. Stay safe.